Some of the most disadvantaged parts of the UK are suffering the effects of the pandemic more acutely than more affluent areas. One area of East London, for example, the borough of Newham, has recorded the worst mortality rate from coronavirus in England and Wales, according to the official figures. Now, our social affairs correspondent Michael Buchanan reports on how badly the community has been hit, and his report does contain some flashing images.
This is not an equalising virus. This is a virus that has a disproportionate effect on those poorer communities here in Newham.
Busy, yeah. We almost done, I think, about 30 bodies within the last couple of weeks.
Past few weeks have been really, I would say, depressing, really difficult.
COVID-19 has preyed on Newham like nowhere else. A mixture of deprivation and ethnicity, allowing the disease to exploit the area's mainly black and Asian population. At the Jamia Mosque, they've seen for themselves the cruel reach of the virus. Some members volunteered to prepare the dead for burial after, they say, a backlog of corpses built up.
Now that would be a sterile area without PPE.
The stock of coffins is now diminished. Over a 10-day period last month, they cleansed and prayed for 32 people.
I think we did 6 or 7 bodies in one day. We cannot forget our deceased. We cannot just leave them to be buried without the ritual washing. We couldn't just stand back and watch them be buried in mass graves.
First couple that I did do, I was thinking about them, but then as it got regular, I just thought, as you know what, I'm doing this for the community, I'm doing it for their family.
Among the victims have been key workers, GP Dr. Yusuf Patel, teacher Dr. Louisa Rajakumari, and Anwar Hussain Oli, one of several taxi drivers who've died.
It is really difficult time for everyone.
Labour councillor Ayesha Chowdhury knows around 15 people have died recently, many of them Bangladeshi.
When they passed away, community cannot even participate on the funeral. They cannot go and visit the family. So everything is completely shocking.
Some in Newham were accused of not taking the virus seriously, at least initially, but the area was at greater risk anyway. Many residents work in jobs that can't be done from home.
Very locally was that.
And the Mayor also highlights high levels of both overcrowding and underlying health conditions.
If we want to avoid a second wave, if we want to minimise the deaths, if we want to stop the risk, we've got to be given the resources, the flexibility at a local level. The command control, top down, will not work in light of what the evidence is showing us.
The same community that has lived through this crisis is now charged with rebuilding Newham. Many teachers at this school had the virus, pupils have lost relatives, and a staff member is caring for 2 children who lost both parents. Bringing hope here means restoring normality.
Being serious about the education we offer actually gives them a way of seeing a future for themselves. We can't obviously turn things back to a different situation, but the fact that they can see a future is the best thing that we can give them.
This COVID crisis reflects the nation's long-standing health inequalities and leaves the poor to feel that once more they'd been left behind. Michael Buchanan, BBC News, Newham in East London.
The past 24 hours has seen the highest daily increase of coronavirus cases across the world since the start of the pandemic. The World Health Organization says 106,000 new cases have been reported, almost 2/3 of which were in just 4 countries: the USA, Russia, Brazil and Saudi Arabia. The continent of Africa, however, has yet to see the kind of numbers of infections and deaths seen in other parts of the world as a result of the virus. The latest figures show just under 3,000 deaths across the whole of Africa, and experts are already saying that some valuable lessons could be learned from that experience, as our senior Africa correspondent Anne Soy now explains.
In the heart of Mogadishu, it's an all-out war against a new enemy. Somalia has known no peace for nearly 3 decades. Its health system is among the world's most fragile. Now, COVID-19 is testing its resilience. Like many African countries, the war-torn nation acted swiftly, but it's far from containing the outbreak. At this hospital, medics are doing all they can to save lives.
The last 3 months, I have not seen my family and my infant child. I have taken a personal decision not to go home so as to reduce the risk of infecting my family and to serve my people as long as I live.
Whole countries and cities have gone quiet. There are lockdowns, curfews and border closures across Africa. And they seem to be paying off for now.
In certain countries, we are seeing a 30% to 100% doubling of the rate on daily basis. But with the lockdown, that over time, it decreased to about 5%. So for sure, the lockdown played a very important role in slowing the spread of the pandemic on the continent. That we can ascertain.
But measures are not working as intended everywhere. We drove around one of Nairobi's hotspots.
It's the first time I've been to Eastleigh since the government announced restrictions into and out of the estate. And I'm really shocked. You don't get a sense that this is being taken seriously here.
In Tanzania, testing stopped a month ago, and the government has urged people not to let fear disrupt normal life. With the rest of the world consumed with their own responses, Africa is now more exposed than ever, and the UN is appealing for more support from donors. COVID-19 has touched every aspect of life, and all predictions point to it being with us for much longer. The winners will be the countries that manage to control its spread, minimize its impact, and move on with everyday life safely. But no one has a template. Anne Soy, BBC News, Nairobi.